Good afternoon, everyone. Thank you for being here. Today we have with us Dr. Hamida Magani, Halton Region's Medical Officer of Health. As well, we have Dr. Neil Rao, Medical Director, Infection Prevention and Control from Halton Healthcare. Dr. Magani will provide an update on today's announcement, and they will both be available for questions afterwards. During question period, I would ask that you put your hand up to ask a question and speak very clearly and loudly so we can hear you. I would like to invite Dr. Magani to the podium.
It is with great sadness that I can confirm Ontario's second death related to the COVID-19 virus. The man in his 50s with underlying health conditions was being treated at Milton District Hospital and then Oakville Trafalgar Memorial Hospital, where he passed away yesterday. We are in the very early stages of collecting information. At this time, what we know is that the individual did not travel outside of Canada recently, nor was he a contact of a known case of COVID-19. I can appreciate the number of questions you may have about the situation. However, we need to respect the family's privacy at this very difficult time. But what I can tell you is this: we need to act now. This is the tragic proof that we need to work together to slow down the spread of COVID-19, not only as individuals, but as a community. We need to take this seriously. I urge you, all of you, to practice social distancing and take action to protect yourself and those around you. Gatherings and parties can wait. Play dates can wait. Some of your errands can also wait. Allow your life to pause. Focus on what is important. This is for the most vulnerable, those that won't get a case that is mild and bounce back. This is for the healthcare workers and first responders, those that are putting their lives on hold to take care of you when you need it. Do your part and do it now. We only have one shot at this, and it's together that it happens. Let's be clear. This is a worldwide issue, larger than our community, and we must all work together to stop the spread of this disease. We will now take questions.
Why was the patient transferred from Milton to Oakville Hospital?
So we understand that the patient was initially admitted at Milton District Hospital and then transferred to Oakville Hospital. We're still gathering information. This type of investigation does take some time, and we need to take the time to do it thoroughly so that on our end, we are identifying anyone who may have been exposed, and we can convey information to them and provide appropriate public health direction. Yes.
Was this man a Milton resident, and can you tell me when he was admitted to hospital?
Yes, he was a Milton resident, and he was admitted to hospital on March the 11th. Yes.
So can you confirm that this death is due to community transmission?
What we see now is that at the moment, we know that he did not travel outside of Canada, nor does he have a link to a known COVID-19 case. And thus, the indication is that there is local transmission.
Is this the first confirmed case in Milton?
I believe that is true.
Have any healthcare professionals been put in self-isolation as a result of this particular case?
As I mentioned before, it's very early. We only received this information late last night. My staff are working very hard to look through, get some more information, and determine who needs to be self-isolated in the community. But overall, the messages are that we need to stop doing things that are non-essential at this time. We need to maintain social distancing and, as much as possible, stay at home.
What do you consider non-essential? Is a car manufacturer
I think it is important for each and every employer to think about that, think about what is essential and what is non-essential. I think, you know, as I mentioned before, gatherings, parties, play dates, those are the types of things that we know are not social distancing. Yes.
Sorry, can you say when this man was transferred from Milton to Oakville?
Just repeat the question again, please.
Sorry, when was he transferred from Milton Hospital to Oakville?
The patient was transferred on March the, I'm just going to get the date exact. I remember the details here. Bear with me. Here it is. The patient was transferred from Oakville to Milton on March 18th at 2 in the morning and died on the same day on arrival in Oakville.
What were the specific underlying health conditions?
For patient privacy reasons, I cannot give that much detail. All I can say is that there was a chronic underlying condition. This is not someone who was perfectly healthy, but someone who was still in a good quality of life prior to the death.
Did this patient take any public transit, public spaces? Do we know that?
I don't have that detail, sorry.
As I mentioned to you, it's still early, and we are trying to get as much information as possible, and we will follow through on that piece. Public health looks into all of these issues and determines who we need to get a hold of.
Was he able to provide any information as to when he started having symptoms prior to admission to hospital?
Again, as I mentioned, we're still investigating, and so that has not been determined.
Can you talk to me a bit about the isolation procedures that took place at both hospitals when this man was
So this patient was seen at the Milton site initially on an emergency room visit in full precautions that we would always use for febrile respiratory illness. So after the SARS era, all patients have been managed with what we call febrile respiratory illness precautions, where people use a surgical mask, a gown and gloves, and face protection during care in general. This is before the COVID era. We've always been doing this. That was done when this patient was seen in the emergency room for the first time. The patient returned a few days later on March 11th and was also managed in the same fashion, was managed on a ward with proper precautions on the ward, commensurate with how we handle community-acquired pneumonia type patients, because that's what this looked like, a pneumonia type of presentation. Then the patient deteriorated and went to the intensive care unit in Milton, and then subsequently, for more specialized ICU care, was transferred to Oakville the day that he died.
When was his actual diagnosis with COVID-19?
The diagnosis was made yesterday on the same day as the death.
What was the time gap between his diagnosis and his death?
The time gap would have been, just to calculate this accurately, he died at 10:15 in the morning, and we had a diagnosis by 9 p.m. last night.
Health Minister Christine Elliott said she was still waiting on confirmation from the coroner's office whether it would be whether it was COVID-19. I'm just wondering how you guys were able to make that declaration. She was.
Okay, so I'm not here to comment on Minister Elliott's process. What I want to say is we have a microbiologic diagnosis based on a test performed at the Ontario Public Health Lab. So combining the clinical picture of someone with a worsening pneumonia syndrome and a positive test using the COVID-19 assay and use at the Ontario Public Health Lab, in my view, this is compatible with the COVID-19 related death.
So just to confirm, I imagine members of his family that came into contact with him are in self-isolation now?
So we're still looking into all of that, and yes, if the family members were determined to have been exposed, then we will direct them to self-isolate. We'll take one final question if there is any.
Sorry, I arrived late. Can I get you to sort of tell me off the top when you spoke about?
Was it live stream? Can we just say? So this is a gentleman in his 50s who passed away yesterday and is a confirmed case of COVID-19.
Do you have a general idea where, like, what region?
He's a Milton resident. He was a Milton resident, excuse me.
Can I ask one last question? It's not a case for an alarm. I know we're in a crazy timeline here, but second death in Ontario, I believe, is here. Is there, like, other than washing hands and social distancing, is there any other messages for residents?
I think it's very clear that the time to act is now. So we are not only seeing an increase, a significant increase in the number of cases, but we're also seeing death. And so it is really important to heed the recommendations from public health very seriously in terms of social distancing, in terms of staying home when you are ill, and staying home as much as possible. If you can work from home, please do so. It is vital to our community that we act now. Thank you for your time.
If the media have any other questions, there's a contact on the media release that was provided to you. Please send your questions through that channel. Thank you very much for being here.